Does being overweight have a negative effect on your life and keep you from doing things you want to do? In this video, we'll share how weight loss surgery can lead to a healthier you, where you are able to be more active and everyday things are more enjoyable. During this session, we'll review the criteria for being a candidate for weight loss surgery, the 3 surgical options, and the lifestyle changes that will help you maintain a healthy weight after surgery. Your body mass index number, or BMI, is a rough estimate of your body fat content. Your BMI number determines which category of weight you fall into. The categories are underweight, normal weight, overweight, obese, and class 3 obesity, which breaks down further to morbid obesity and severe morbid obesity. Currently, 65% of people in the US are either overweight or obese. This number is predicted to increase to 85% in the next 10 years. 75% of obese children become obese adults. This, in part, could be a result of genetic makeup and metabolism function, which is evident when you see obesity that runs in families. More than 1 in 20 adults are not just overweight or obese, but have clinically severe obesity, which is a BMI of 35 and higher. 16 million Americans are in this category, known as morbid obesity. A bariatric surgeon will consider your BMI to determine if you qualify for weight loss surgery. Typically, if you have a BMI of 40 or higher, you automatically qualify. If your BMI is 35 to 40, you need to have a weight-related medical problem to qualify for surgery. The goal of every bariatric weight loss surgical procedure is to assist the patient in reducing daily calorie intake. But weight loss surgery is just a tool for helping a person lose weight. In order for a patient to achieve their weight loss goals and maintain a lower weight, there must be a commitment to lifelong lifestyle changes, which include exercise and healthy eating. On average, patients lose 55% of excess body weight, and 85% of patients achieve long-term success. Our Summit Health Bariatrics team performs 3 procedures: sleeve gastrectomy, Roux-en-Y gastric bypass, and duodenal switch. Sleeve gastrectomy is the most common bariatric procedure currently performed in the United States. This is a gastric-only procedure that involves us leaving the small intestine alone and removing approximately 80 to 85% of the stomach, with the remaining stomach, approximately the size and shape of a banana, being stapled closed. The resulting smaller stomach enables the patient to feel fuller sooner after eating. The section of the stomach that is removed is where hunger hormones are produced, so the patient will feel less hungry and not have that appetite drive post-surgery. Patients that undergo this procedure on average lose approximately 50 to 65% of excess body weight. There are risks with any surgical procedure, but these are exceedingly low, and sleeve gastrectomy is one of the safest procedures performed today. Some of the risks that could occur early on include leaks, blood clots, pulmonary embolism, pneumonia, and bleeding. Ulcers may occur at a later stage. A duodenal switch is a sleeve gastrectomy combined with an intestinal bypass. Patients undergoing this procedure lose approximately 70 to 90% of their excess body weight. Early risks could include leaks, pulmonary embolus, pneumonia, blood clots, bleeding, and potential vitamin deficiencies. Late risks could include small bowel obstruction, which could occur years post-surgery, ulcers, low blood sugar, and malnutrition. Gastric bypass has long been considered the gold standard that every bariatric procedure is compared to. This procedure consists of making a small pouch out of the proximal stomach, dividing the small intestine, bringing the distal portion of the small intestine up to the gastric pouch, and then attaching the small intestine further down. The result is the flow of food comes down the esophagus into your newly formed stomach pouch, then into the small intestine, bypassing the remaining stomach and first portion of the small intestine. All of your digestive enzymes from your liver and pancreas are directed into the unused portion of the small intestine and will mix with the ingested food further down. Patients undergoing this surgery lose approximately 55 to 75% of excess body weight. Early risks could include leaks, pulmonary embolus, pneumonia, blood clots, bleeding, and potential vitamin deficiencies. Late risks could include small bowel obstruction, which could occur years post-surgery and is very rare, a 1 to 4% chance of narrowing at the connection site, and marginal ulcers at the stomach to the small intestine connection, which can be treated with medication. Because the stomach is now smaller, there are changes in hunger hormones that stimulate appetite and inhibit insulin secretions. The health benefits of bariatric surgery include resolved or improved diabetes, resolved or improved hypertension, resolved or improved sleep apnea, a lower risk of cancer, and improved fertility in women with insulin-resistant conditions like polycystic ovary syndrome, PCOS. Contact one of our offices to learn more.